Of all the joints that arthritis affects, the hip joint is the most common. Pain is felt in the groin and buttock region. If the pain is experienced only in the buttock and travels down the leg, the cause could be back problems and not hip arthritis. Once it becomes painful to walk and the pain wakes you at night, it is time to consider a hip replacement. I will examine your hip and arrange x-rays of your pelvis and hip. Arthritis shows up on x-rays as a lack of space between the ball and socket joint, with the two bones grinding against each other. This leads to small fractures, with small pieces of bone forming in the hip joint. This will cause the stiffness and decreased movement in the hip joint. I will advise you on the different hip replacements available, and will recommend the best hip replacement that suits your age and physical demands. As well as using the normal incision to perform the replacement, I specialize in minimally invasive approaches where I perform the hip replacement through a 7 cm incision without cutting or damaging any muscles. This minimizes the pain experienced and allows for early mobilization with the lowest chance of hip dislocations. After the operation, you'll spend 1 night in ICU and 5 nights in a general ward with a physiotherapist seeing you and giving you exercises to do from the very first day. Once you're walking unaided and walking up and down stairs, you'll be discharged home with compression stockings and a drug to stop blood clots. You will use these for 6 weeks. I will follow you up at 2 weeks, 6 weeks, and at 6 months. One of the biggest complications of hip replacements is hip dislocations. The physiotherapist will help you modify your activities of daily living and strengthen your muscles to avoid this happening. A hip replacement is one of the most successful and rewarding operations. It will allow you to once again enjoy all of the sporting activities and social events